My name is Dr. Oluseyi Atanda. I'm an obstetrician, gynecologist, a fertility expert, and I'm the chief consultant at SW Aquacare.
So, been having issue regarding our surrogate moms as per the post we made on social media. Quite a number of them are having fears regarding CH and surrogacy. Can you please elaborate more on what is surrogacy and the term surrogacy?
Yeah, surrogacy is, in simple terms, is called the pregnancy carrier.
Okay.
Somebody who volunteers to carry pregnancy on behalf of someone else who, for whatever reason, is unable to carry pregnancy on her own.
So, is a surrogate mom in anyhow related to the child?
Biologically, no. Because usually the surrogate mother is only carrying pregnancy. She's not the owner of the pregnancy. She's not the owner of the egg. Neither, even if she's married, her husband is not responsible for the pregnancy. So there is a couple that is responsible for pregnancy, and there is someone else who is now the gestational carrier who volunteers to carry pregnancy on their behalf.
Okay, so can you please tell us what is Caesarean section? Why is it necessary in surrogacy?
Well, Caesarean section is, in simple terms, is abdominal delivery via an operation. Instead of the woman delivering by vagina, the baby is brought out through the abdomen. It's an incision on the abdomen, and baby is brought out, and the abdomen is closed back. That is Caesarean section.
So why is it necessary in surrogacy section?
Well, even nowadays, before surrogacy, quite a number of women are opting for Caesarean section, because that old dictum that women shall labor in pain. Ladies of nowadays feel labor is even more painful than Caesarean section. And now Caesarean section is so easy, unlike those days that when you do a CS, you're in the hospital for 7 days. Now when you do a CS, people are discharged home 3 days after Caesarean section, and at worst 4 days. Even some women go home 48 hours after Caesarean section. But on the average, it is 3 to 4 days. Now, why we say Caesarean section for surrogate mothers in most hospitals, even if you have carried pregnancy yourself, because it's an IVF baby, it's a precious baby. You can guarantee the quality of the baby after delivery at CS compared with vaginal delivery. Because vaginal delivery, the woman will labor for 6 to 14 hours, and you never can tell what will happen. The baby may have cord round the neck, or something may be wrong in the abdomen. Even if a woman is pregnant on her own, labor may go the other way, and they go and do an emergency CS. People have done emergency CS and baby ends up dying, or baby ends up spending extra days in the hospital to get well. And surrogacy is quite expensive. IVF is expensive. That is why IVF hospitals have adopted the protocol that CS is safer to guarantee a quality baby that is not born with any complaint. So baby is delivered safely, and the surrogate mother too is also safe and goes home 3 or 4 days after surgery.
Alright, sir. Are there any long-term consequences for the surrogate mom?
Well, nothing different from any other woman who has done CS on her own. The challenge she may have is because she has done one CS, there's a likelihood she may do another one when she's going to have another baby for herself. Because if she's pregnant on her own and she does not fall into labor till her date, then they will have to do a C-section for her. But if she falls in labor, of course she will labor. Women who have had one Caesarean section does not mean she must have another Caesarean section. Following C-section for surrogacy, that does not stop you from having vaginal delivery when you will have your own baby.
Okay, so how does the recovery process after CS differ from that of vaginal birth? Is there any difference?
Well, the only difference is for vaginal birth, you go home 24 hours after delivery. But for CS, because for the first 36 hours, you will still be on IV drugs. Then by 2 days after surgery, your drugs are converted to oral tablets so that by 3rd day, you will go home, or at worst 4th day after surgery.
Okay, so let's say in a 2 or 3 sentences, what do you have for our intending surrogates who are afraid of CS?
Well, the first thing we should say is Caesarean section is safe. Whether you are the owner of the pregnancy or you are just a gestational carrier, Caesarean section is safe once it is done in IVF hospitals. Most IVF hospitals are standard hospitals where Caesarean section can be done safely, and if there are complications, they have the facility to take care of complications. So if you have a heart to help a couple who cannot carry pregnancy on their own, please follow your heart and you will be safe for it.
Thank you very much, sir.
Thank you too.